Hi, I'm Chol Kim. I'm a spine surgeon in San Diego. And one of the things that we do here is a skin-to-skin program that's designed to help surgeons establish a minimally invasive spine practice and address what I think is probably the most important obstacle to adopting an MIS procedure, and that tends to be what we call the learning curve. The purpose of the Skin-to-Skin program is specifically designed to make the first case go well. A typical Skin-to-Skin program involves essentially 2 days. The first day, the surgeon will observe a procedure in the operating room so that they can see in a real-life setting the logistics of how the patient is brought in, positioned, and how the entire team interacts to make that surgery go well. And by seeing a patient have the procedure in a live operating room setting, seeing the patient the next day to see how they're really doing, and then practicing that same procedure in the cadaver lab start to finish without any distractions, almost like it's a real live surgery, allows the surgeon to feel very comfortable when they go back and perform the procedure themselves for the first time.
There are surgeons that come here with the MIS experience already, but they just want to see how Dr. Kim does things differently. That makes a unique experience because it's a great exchange of ideas. So we have a wealth of knowledge here in San Diego because many brilliant minds from all over the country have come here, and Dr. Kim teaches his technique, but everyone that comes here also offers something.
The Skin-to-Skin program is not just one event. It starts even before the program is instituted by making sure that the surgeons that come here are ready for an intensive one-on-one course and training. Once that happens, when they go back, it's equally important to stay in contact because every patient's a little different, and by having this one-on-one interaction, it also facilitates a much easier, more comfortable interaction between the visiting surgeon and the faculty members. So I stay in contact with a lot of my visiting surgeons well after the Skin-to-Skin cadaver lab, and that's a critical component of the whole Skin-to-Skin program.
Hi, I'm Dr. James McNutt. I am a neurosurgeon in Duluth, Minnesota. I'm interested in expanding my practice to include MIS cases, minimally invasive cases, which is something I didn't have much training when I was a resident. I'm at the point in my practice where it's time to start doing new things, and this is really on the vanguard of what we're doing as spine surgeons. The thing about MIS is that it's nuanced, and it's not the sort of thing you're going to learn in a book. So the only way to really get a handle on this sort of thing is to see it and do it. I think the single most important issue is watching how he goes about doing it in the OR. He brought me in to see his patients beforehand. We went over the films together, and then I saw how he approached it in the OR, which is the way I'm going to have to do it in real life. So I think just that experience, even by itself, as passive as that looked, I think that was incredibly helpful.
The Skin-to-Skin program is unique to most of the other minimally invasive courses that I've been a part of because this is the only program where there's an extreme emphasis on being able to do the surgery start to finish, and hence the name Skin-to-Skin. And it's no different than any sport that you may play in a competitive setting. You want to do a scrimmage first. You want to make sure that you're comfortable doing something in a cadaver lab before you do it in real life.